Welcome to today's SheepConnect SA 10-minute talk on preventable diseases and options available for their control. I'm Bart Dessart, part of the SheepConnect SA team, and today our speaker is Mary Rowe, Senior Sales Manager at Zoetis. Over to you, Mary.
Thanks, Bart. We'll just have a bit of a talk about some of the preventable diseases and the range of options for these diseases. So when we think about diseases which are causing production losses on farm, the most common ones start with things like pulpy kidney, tetanus and cheesy gland. And sometimes after that, we get other production losses from the other clostridials being Black's disease, black leg and malignant edema. I thought we'd jump into an overview of what these diseases look like on farm, and maybe that will help producers make an informed decision about which vaccine is the best fit for their business. So cheesy gland is caused by bacteria. It infects the lymph nodes, and most of us would have seen these lymph nodes when they burst, can be full of large fluid, sort of yellowy pus. As these lesions get older, they tend to dry out a bit. They can be found anywhere where there is lymph nodes in the animal. So the most common we see at shearing time, for example, is a lymph node in the shoulder. And if we're slaughtering animals, it is quite common to see them in lymph nodes throughout the organs, and particularly around the lungs. Anyone that has seen these lesions will recognise them. The lesions can also be found in the muscle tissue. So these cheesy glands are a significant problem, because if an animal goes to the abattoir and has one of these lesions, it will result in trimming. If that lesion is in the forequarter of the animal, it will generally result in the trimming of a large portion of that forequarter. If a lesion is higher up in the carcass and bursts, it can mean the best part of the carcass is condemned. In line with cheesy gland, we get some on-farm production losses, the bulk of these being related to a reduction in wool cut for the year in which the animal gets the infection. So the wool growth is reduced to about 10 to 15% in the year the animal gets infection. How widespread is it? Where animals aren't vaccinated, it is common to see up to 40% of the animals infected. If we have an incomplete vaccination program, it is normal to see about 30% infection. And if we have a complete vaccination program, we would expect to see less than 3%. Incomplete program means an animal getting a dose perhaps at weaning, but no boosters thereon for its life. A complete program means an animal has been given a priming dose early in life, perhaps marking, a booster dose perhaps at weaning, and then an annual booster each year throughout its life. Another disease that causes significant losses is pulpy kidney. Most of the time we diagnose pulpy kidney simply as sudden death. You put the sheep into a good paddock, or perhaps put some into the feedlot, and the next day or the next few days you have animals that have died and rotted very quickly. The spores which cause pulpy kidney survive in the environment and in the gut of healthy sheep. So they're essentially everywhere. They're ingested from the pasture and or the soil, and they're triggered by a sudden change in diet. That sudden change in diet can be going onto a stubble with a lot of grain. It can be going into a feedlot. It could be going onto a pelletized ration. When the carbohydrate level changes in the rumen, it makes the conditions more favourable for these spores that are causing the pulpy kidney. The animal has an outbreak. It overwhelms the animal and causes and kills it. It can often be misdiagnosed as bloat, and that is because of the association of the frequency with which it happens when animals go on to these high carbohydrate diets. The difference is animals with pulpy kidney rot extremely quickly. Within a couple hours of death, you'll notice discoloration of the skin and significant swelling or edema in between the muscle and the skin of the animal. Young animals tend to be the most susceptible. So to prevent that, we look to booster animals a couple of weeks before these challenge events occur. Tetanus is quite common as well. So the tetanus spores are in the environment. They cause paralysis and they can cause sudden death. So in young lambs, we tend to see them present as sudden death. In older sheep, you tend to get paralysis where it may take a week or so for the animal to gradually stiffen up, go to a point where it can no longer retract any of its limbs, roll over on its side and die. It is not economically treatable. So The animal will pick it up anytime there is a wound, and this can simply be from the umbilical cord at birth. Further losses may then occur after castration or mulesing, and sometimes from shearing wounds. So tetanus is best prevented by vaccinating a lamb's mother so that it has antibody protection as soon as it consumes colostrum, and then boosting that own animal throughout its life. Erysipelas or arthritis is another disease causing production losses on farm. So these losses range from having lambs infected very early in life may just die, lame lambs coming through at lamb marking or weaning. This is associated with poor growth rates and the animal welfare issues that are associated with having animals which can't weight bear on all limbs and may not be fit to load. What we typically see on farm is the swollen front knees and then the lamb trying to walk on its knees. There is a couple of causes of arthritis, so we can get bacterial arthritis, chlamydial arthritis, or erysipelas. Most of what we see is erysipelas. Erysipelas is not particularly treatable because by the time an animal is identified as having a problem, the window to treat has generally passed. It causes swelling in the joints. The animal picks up these bacteria from the environment, and it can pick them up through the umbilical cord or from the dam, actually transmitting that bacteria directly to her lamb shortly after birth. The bacteria then localizes in the joints, and the animal is generally unable to mount an immune response to that challenge. It causes thickening in the joints, and then in time, the animal will go either quite lame. Some animals do recover somewhat, and then once they go into the feedlot, we see poor performers. Typically, these have some arthritis, either in the leg joints or sometimes in the vertebrae. It causes significant trimming at abattoirs. If a lamb is trimmed for arthritis, we generally are looking at about 3.5 kilos loss in carcass weight. Scabby mouth is another on-farm production loss. It typically affects lambs, and it typically affects animals around the mouth and nose, although it can also appear on the feet. When we get scabby mouth on farm, we often see an increase in mastitis in ewes because a suckling lamb will then transmit that scabby mouth virus directly to the teats of the ewe, which can contribute to mastitis losses. It certainly interferes with grazing and suckling, and we look generally at about a 4 to 6 week period from an animal picking up the infection before they shed the infection and return to a normal feeding pattern. The next point in a lamb's life we often see scabby mouth is during feedlotting, and this is because if one lamb has scabby mouth and scabs fall off in the feed trays, other lambs will invariably come into contact with that virus, and if they are susceptible, will pick up the infection. We also see abrasive feeds trigger outbreaks, so this can be in the summer months if lambs are grazing on stubbles or if there's quite a bit of thistle or other woody weeds out in a paddock. The virus lasts for years in the environment, so once you have it on farm, you will have it for the rest of your farming career. Additionally, it presents an OH&S risk to people handling sheep, especially crutches and shearers. Yonis disease is another issue for producers around the area, mainly because there is no known cure for it. And once it enters a property, it can be a number of years before a producer may be aware they have a problem with Yonis disease. So it takes a couple of years from a sheep picking up the Yonis bacterium till the animal will start to shed. Once they start to shed, about 9 months later, we'll see that animal start to waste, and the entire disease process in an animal can be 3 to 5 years. Once we start to get significant contamination on farm, we see animals picking the infection up younger and picking up much higher levels of infection, which means their condition and the rate of weight loss will increase. The bacteria survives for a couple of years in the environment, and it is usually introduced to properties through purchasing infected sheep. It can be largely prevented through the use of a single vaccination program with good air. That sums up the diseases that we see most commonly on farm. The things you will need to consider when choosing a vaccination program for your flock include the diseases commonly seen on your farm or in your area and how you choose to manage risk.
Thanks Mary for sharing your experience and expertise with us today.